then if you have to do it in bed, the older ones are here.
Good afternoon. I'll keep this as short as I can, but as informative and educational as I can. A group of my classmates and myself from medical school and residency have been communicating about this coronavirus, COVID-19, and about all the talk and a lot of misinformation about this virus. So we all decided to get together in our respective communities and give what we know as the most up-to-date information about this. The reason I'm here today is because there's a lot of misinformation that's going around on social media about this, and sources being cited that are not reputable medical sources, and things that are being said that are not true. Second reason I'm here is because this is now considered to be a pandemic, which means that it's a worldwide problem. Friday, South Carolina was deemed in a state of emergency, and many of you may not know, yesterday, Horry County and Conway was deemed in a state of emergency. What a lot of you may not know is between the morning service and this service, there has been one presumptive positive case at Grandstone. As I said this morning, that's going to happen. Before I became a physician, I studied viruses, I worked with the CDC, and the way viruses, particularly new viruses, go, this was inevitable to happen. This spread is inevitable to happen. And there are lots of reasons why. Certainly, the response was much slower than it should have been, and that's water under the bridge, and now we need to go forward. But just a little background information about this, and I promise you I won't be long, but these are some things that you need to hear. Back in December, this past December, there were reports coming out of China that there was a mysterious illness that was going on that were having people go to the hospital with pneumonia, a lot of them sick, a lot of them died. A month later, in January, 2 months ago, the World Health Organization, which is deemed responsible for giving information to the world about health issues, declared that this was a public health emergency of international concern. And when doctors start hearing stuff like that, it makes you kind of nervous. In the last 100 years, there's only been 3 pandemics. All of them were related to the flu and strains of the flu, but this was different. This was not the flu. It had characteristics of the flu, but it was definitely different. Several weeks ago, the World Health Organization, as I said earlier, did declare this a pandemic, which means that it was spreading and it was likely to get worse. Now, as far as the severity, worldwide, over 150,000 people have tested positive. Worldwide, over 5,000 have died. In the United States, over 2,600 have tested positive, and over 50 have died. Now, I give you those numbers understanding that people are being grossly under-tested. So every number that I gave you is a small sample of what this probably is. I'm not trying to scare you, I'm trying to tell you it is what it is. I'm not trying to scare you, but I'm trying to educate you about what it is. At this time, there's only one state in the United States that has not had a positive test, and that's West Virginia. Somebody asked me why. I said probably because they don't have the test, or they're not testing enough people. I certainly don't believe it's because there's no people in West Virginia that don't have this. That would be crazy to think that. In South Carolina right now, there are 19 confirmed cases as of this morning. Now, like I said, something just changed in Horry County since then, so those numbers are going to go up. Counties in South Carolina involved are Charleston, Beaufort, Lexington, Kershaw, Lancaster, Spartanburg, and now Horry. But as health professionals, we know that this is going to get worse before it gets better. Someone asked me earlier, how long do I think it's going to last? Well, I don't know. I know as a person who studied viruses, I know as a person who worked with the CDC, my best estimate, and I'm not a betting man, certainly I don't bet in church, but if I had to imagine, this will be at least 4 to 8 weeks, if not longer. If not longer. So let's talk about prevention. What can we do? For the purpose of this talk, I broke it down into community, and I broke it down to churches. The community, if you've got any chronic conditions, uncontrolled diabetes, lung issues, cancer, any other kind of chronic conditions, you may want to avoid large crowds. Now, somebody asked me, well, Doc, what's the definition of a large crowd? Again, to me, if it's over 200 people, if it's over 300 people, and you got a chronic condition, you might want to avoid that crowd. That's just me talking. Wash your hands at least 30 seconds. At least 30 seconds. With soap and with hot water. Next, keep your hands away from your face, your mouth, and your nose. Those are places where the virus can hang out. For how long? We don't know. I hear these people talk on TV about this amount of time, that amount of time, this amount of time. They don't know. They don't know. This is new. Next thing. If you're going to use hand sanitizer, and as I said earlier, Purell is making a killing. If you're going to use hand sanitizer, make sure that it has at least 60% alcohol. At least 60% alcohol in that hand sanitizer. There's some knockoff brands with 30%, 40%. You're not doing anything to that virus. At least 60%. Somebody asked me earlier, well, can I just use 90% alcohol? Well, you can't use that for so long because it'll dry your hands out and you probably get an allergic reaction if you keep doing that. But at least 60%. Eat a well-balanced meal. Take your meds as prescribed by your physician. Might not be a bad idea to take multivitamins. Get your proper rest and reduce your stress. Churches, what can we do? These are some things I talked with Reverend P about yesterday, and some things that we will likely be implementing here at Friendship, and hopefully other churches as well. Handshake. It's in our culture to handshake. It's just in our nature to do so. My advice to you is don't shake hands. I see a lot of people fist pump. That's cool too, but what if it's on your fist? So the best thing to do is give a little elbow bump, like the senator said. That's safe, that's good. There's also talk about handling money. My suggestion, if you're handling large sums of money, that you wear gloves. Thinking about possible ways that this can spread. Another thing I'm about to say, and it might make some people upset, but I'm going to say it anyway. If you're sick, stay at home. If you call your physician and you tell them you have viral-like symptoms, they're 9 times out of 10 going to tell you to stay at home. I'm going to tell you to stay at home. If you're sick, stay at home. Now, here's one caveat to that. If you're having shortness of breath and you're getting worse breathing-wise, that's different. Then at that point in time, you probably need to go to the hospital to seek medical attention. Now, there is a number that DHEC has, and it's on Conway Hospital's website, that you can actually call if you think that you may have this virus. You'll talk to someone who's trained in this, they'll ask you questions, and then they'll guide you on where to go. Grand Strand is testing, Conway is starting to test. Physicians' offices don't have the test. I don't have tests in my office. Physicians don't have this test. Number two, there is no treatment for this. Antibiotics don't kill viruses. So if you're sick, stay at home. If you're really sick and you just feel like you just can't breathe, then you need to seek medical attention. Call your physician's office, call the hospitals, and they can guide you where to go from there. Next, we will likely be changing communion practices here. I talked with Reverend P about it, and we'll go to some kind of individual situation, but he and I will talk more about that later. But that will change likely as we have been doing it, at least for some time. Next, wipe down and sanitize areas of high traffic. Doorknobs, handles, refrigerators, kitchen counters, going out to restaurants. Just make sure you take your hand sanitizer with you. Just make sure that you're practicing good precautions. If you sneeze, sneeze in your elbow. If you're using a napkin or a tissue, use it and throw it away. Don't keep it hanging around. Now, I was asked this other question, and I'm not going to be much longer, Reverend P. I was asked this question: where in the world did this come from? Where did the coronavirus come from? Well, the true fact of the matter is coronavirus is a large family of viruses that are fairly common in humans, fairly common in certain species of animals: camels, cattle, bats, cats. But rarely does the virus in animals go to humans. We've had 3 cases now: SARS, which we had a couple years ago, MERS, which we had a couple years ago, and now COVID-19. The thought is that this virus came from a bat. First incidents were found in a province in China called the Wuhan province. The initial people were isolated to go to this live market where they sold live animals, including bats. Understood that, but the problem is people started showing up with this virus who had not been to that market, had not been exposed to people who had been to that market. So then we knew it went from animals humans to humans to humans. Thus the spread, thus the pandemic. I'm not trying to scare anybody, but I am trying to bring sense to some of this nonsense that's been on social media. Sense to some of this misinformation that's being posted on social media. And I know people mean well. A lot of people spreading this stuff don't even know they're getting it from unreliable sources. So be careful what we spread. As physicians, we don't mind talking to people about what you read, but just be careful what we spread, because some of the sources are not reliable sources. They're not grade A medical authorities on what's going on. And the truth of the matter is we're learning about this week to week. I was asked by a radio station and a TV station to give a talk about this 2 weeks ago, and I told them I couldn't do it. They said, why not? I said, because what I tell you now is going to be different from what I'm going to tell you 2 weeks from now. I feel more comfortable talking about it now. I feel the need to talk about it now because, unfortunately, this is not going to stop in the very, very near future. I'm not trying to scare you. I'm just telling you to use precautions, use good hygiene, and just be as safe as you can, okay? As more information comes out, I will pass it along. This is one handout that I will give to Reverend P. Mr. Parker so that we can put out some CDC guidelines, World Health Organization guidelines to try and reduce and stop the spread of germs. Yes, that's another question that I got asked. There's a couple of myths that's been going around, and I want to kind of dispel some of those as we know it today. The question is, and I've seen this on social media more than 1 or 2 times, is that African Americans cannot get this virus. And I was asked that question. They were asking me this seriously because of what they read on Facebook. And my answer was, well, if African Americans can get the flu, we certainly can get coronavirus. So that is false. Somebody said, well, I don't really hear about any cases popping up in Africa. They're popping up in Africa too. Somebody else asked me, well, Doc, these viruses, they seem to go on only during cold months. So we don't have anything to worry about because it's getting warm, right? I said, well, there's 200 cases and about 5 deaths in Australia. Guess what? It's summer in Australia. I was also asked, well, Doc, if I just load up on antibiotics, man, I'll be good, right? Wrong. Antibiotics don't kill viruses. So the best I can tell you is to be safe, practice good hygiene, less handshaking, even a little less fist pumping, a little bit more elbow bumping, and protect yourself. Thank you.